Thank you.
Thank you. So today's my topic is metabolic evaluation of uterine leiomyoma ablated by HIFU. So I will use English as my working language because many of you are from foreign countries.
Thanks for the conference organizer for putting together this engagement program and giving this great opportunity to share our research entitled The Metabolic Evaluation of Uterine Leiomyoma Ablated by Fusion HIFU Treatment. So I will start introducing what is metabolomics and also demonstrate our cohort establishment and preliminary results. So what is omic? Omic is a study of an entity for a biological discipline. And for genomic is study for all the DNA, transcriptomic study all the RNA, proteomic is study all the protein, metabolomic is study of a small molecule that can be the carbohydrate, sugar, and protein, fat that eat by us that can be used to generate energy, assimilate into body, or catabolize, break down into biological waste, and excrete out of body. So what is metabolomics? It's study of a small molecule that's least near 1,000 kilodalton, not protein. It can be the small molecule uptake by the cell, secreted by the cell, or retained in the biological fluid. And inside the cell, it can be precursor, intermediate, or the product of intracellular metabolic pathway. And together with advanced chromatography and modern mass spec technology, allow us to identify 100 to 1,000 of small molecules in a single biological sample, which makes it achievable to study global human metabolism for biomarker discovery and precise medicine. And I am a big believer of HIFU or FUSA. It's a promising novel technique for non-invasive ablation of tumor. It has been widely used for various benign and malignant tumor, especially the uterine leiomyoma. Despite its clinical promising, the underlying metabolic mechanism in response to the HIFU treatment remain unclear. Why some patients that can, after treatment, respond so well and recover quickly without adverse outcome, and other patients recover slowly with severe adverse outcome. So by understanding its underlying mechanisms may allow us to propose a new adjuvant therapy together with HIFU to improve and facilitate its clinical outcomes. So the end of my talk is to demonstrate by combining the clinical studies, collect the samples, combined with mass spec technology to comprehensive metabolic evaluation of uterine leiomyoma ablated by the FUSA treatment. So we have established recruiting patients last year, and we have collected a sample before and after HIFU treatment, as well as 3 months, 6 months, and 1 year. And we have collected hair, urine, plasma, saliva, skin secretions. And here's a photo of my student collecting sample in the HIFU hospital. And then they bring the sample to the lab, process the samples. And so far, we have collected over 40 normal patients and 37 patients with uterine leiomyoma. And we should be able to complete the preliminary collection by end of this month. And we also collect some association questionnaire related to the cancer. And also, this is a typical fatty acid profile of plasma analyzed by GCMS. And we also able to identify the element from the hair from the patient with leiomyoma. And just here's some of our preliminary results show the elemental profile of urine and plasma. We see there's significant difference for the patient before and after HIFU treatment, and as well as compared to the control. And we can see the plasma profile. There's a clear separation of uterine leiomyoma before and after HIFU treatment, especially when we find there's a higher level of the aromatic amino acids such as tryptophan, phenylalanine, and methionine, as well as the polyunsaturated fatty acid, including the arachidonic acid, DHA, EPA. We also find a clear separation of urine metabolic profile and particularly high level of amino acid derivative. And here is the plasma lipidomic profile generated by our lab that can detect the triglyceride, cholesterol, sphingolipid, and this is oxalipin oxidation of fatty acid. And we also going to validate our result using mice model by isolation the primary cell for uterine leiomyoma and inoculate into the mice and co-culture was microphage to see the metabolic changes. And we have successfully isolated the primary cell from leiomyoma of patient. And so I won't go through the conclusion of the time, sorry. So 在这边我是想跟大家密切的做一些科研的合作，就示范一下大学主学可以做HIFU哪一些的事情。
最后
Support. Thank you for the Mass Spec Center of Maternal Fetal Medicine. This is our Mass Spec facility, and thank you for all my students. Thank you for your listening.